big rally not long ago, last year, and I said, everybody take a seat. And the press said, Biden's so stupid, didn't know they didn't have any chairs. Well, hello, Joliet. Audrey, there's men like Audrey all across America who are struggling and worrying every day about how they take care of themselves and take care of their needs, particularly in the area of health. You know, thanks to you having one of the best congressional delegations in America, and that's not hyperbole. Including my buddy, and Senator Tammy Duckworth, a genuine, we talk about American heroes, this is an American hero. This is an American hero. She risked her life and gave everything. If I had time, I'd spend the whole time talking about what she did, defending our nation, a tireless fighter for her constituents, supporting families and supporting our veterans. I mean it. Thank you, Tammy. It's great to be with another terrific member of Congress, Robin Kelly, a champion of women and children, not only in her district, but all across America. Seriously, when I have a question, I pick up the phone and I call her and ask for advice. Your very own Congresswoman Lauren Underwood. Lauren, thank you, thank you, thank you. No, I didn't know she spoke, but the only part of it that didn't surprise me was you picked up the phone and called her. You picked up the phone and called her. You know why? Not only are you a hell of a congresswoman, you're a nurse. No, I'm serious. There's something special about nurses. Maybe it's because, no. I genuinely mean it. I, like many of you, have been a considerable consumer of health care in my family, losing family members as well as saving family members. And spent a lot of time early on with myself in ICU a long time ago. And you know, docs allow you to let you live. But you know, I often say if there are any angels in heaven, they're all nurses, male and female. Doctors let you live, nurses make you want to live. No, I'm not joking, male and female. I remember being in ICU looking at those monitors after a 9-hour operation and thinking to myself, I wasn't hurting, I just was tired. I just wanted to just let it go. I knew the line went flat. All kidding aside, some of you had a similar experience. And my nurse, I'll never forget her name, Pearl Nelson at Walter Reed, come up and whisper in my ear, stroke my face, make me and talk to me. Talk to me. You know, it's just amazing what nurses do. And Lauren is a person you can always count on. She's always there. You know, in just her first 2 terms of office, she got 10 pieces of legislation passed into law. 10 pieces. A lot of my Republican colleagues spend 10 years and don't get 1 piece passed into law. But all kidding aside, you know, lowering health care costs, improving care for women who serve in the armed forces, increasing the number of veterans trained in health care jobs, protecting America's supply of critical prescription drugs and medical devices. And most of those were bipartisan efforts she put together. And by the way, Lauren does her job. It reminds me of what my dad used to say. He used to say, I'm not looking to the government to solve my problems. I just want them to understand my problems. About 2 programs Lauren understands to her core. Quite frankly, I've been in the Congress a long time. I never thought everything we programs do. And the idea that a hardworking person would retire and be in real trouble, deprived of their dignity, is just something beyond comprehension to most of us. That's how it should be in the United States. Lauren talks about people she grew up with. They're folks we all know. They're you in this auditorium. They're people I grew up with. Imagine a nurse from Lauren's hometown in Naperville who's been serving patients for decades. She's paid into the Medicare system and the Social Security system with every paycheck. She's getting ready to retire, this nurse, imaginary nurse, trying to make plans for a future. With those calloused hands and aching back, will be others. And my mom was fiercely independent. And I remember she used to go up to the local drugstore to get her prescriptions. And she wouldn't tell us, but she didn't have enough money to pay for some of those prescriptions. And so to save her pride, I went up and gave him a credit card and said, whatever she has, whatever prescription she has, we didn't want dignity. Security, Medicare. It'd be impossible for him to afford the care he needs. Bill. Most folks have all seen care they could count on. And think about what it does to your. We're proud people, especially those who busted their neck their whole life and paid into the system. But then we came together as a country and said, no, we can do a hell of a lot better than this. Social Security and Medicare are more than government programs. And contribute, and when time comes to retire, things are going to be a little easier for you. Not Social Security. But there's a rock out, and we've counted on it. It's a rock-solid guarantee, an ironclad commitment. Generations of Americans have counted on it, and it works. If we didn't have Social Security, the poverty rate for those over 65 would be 4 times what it is now. 4 times. I love those signs when I came in. Socialism. Great. What idiots. Socialism. Whoa. No one ever doubts I mean what I say. Sometimes, unfortunately, I say all that I mean. Look, think about in this district alone, more than 100,000 people over the age of 65 in Lawrence District. Some people have means. Others are living day to day on Social Security and Medicare. That's why Lauren and I are going to keep protecting and strengthening these programs. I believe that hard work should be rewarded. And I believe that we should have no one leave and struggle. And members of your delegation, we passed the Inflation Reduction Act because it made Medicare stronger, Look, take prescription drugs. Folks, we pay the highest price for prescription drugs of any developed nation in the world. Same drug, same. Many of these drugs they come up with their consequence of ought to give negotiate what VA has been able to, as they should. Hey, so you want to sell us, figuratively speaking, I don't mean it literally, aspirin and a penny a piece, we're only going to pay half a penny. You don't want to sell it to us, we'll go somewhere else. But for years, Big Pharma has blocked us from being able to negotiate that. They were the only exception out there. But not this year. We finally beat Big Pharma. Finally. Medicare will finally have the power to negotiate lower. Seniors will see their out-of-pocket are paying 7 prescriptions. Disease. In front of me, we cap that level. No senior starting January 1 will have to pay more than $2,000 a year for all their drugs. $14,000 a year, no more than $2,000 a year, and the companies will. We're capping the cost. How many of you know somebody who needs insulin for their diabetes? Raise your hand. Every audience. See that, Dick? Almost everybody, I would say at least half this audience raised their hand. You know how much it costs to make that particular that insulin? Costs $10, T-E-N, $10 to make it. That's it, 10. But packaged, this isn't working, I guess. Maybe as much as 15. Not going to have to pay more than $35 a month, period. $35 for one insulin. So starting in January, one other thing we changed. Starting in January, Big Pharma raises drug prices faster than inflation. They're going to have to write a check for the difference to Medicare. What's the rationale? This past year, drug companies raised the price on more than one middle of this recession, quote unquote, as Republicans say. It's not a recession, but the middle is really turned down here in terms of expense. The rate of inflation. Just last year. Recommended vaccines like shingles vaccines are going to be available for free, no copay. Last year, more than 2 million to $200. And you wonder how many seniors. We don't have to make that choice anymore. Prepare. Every for the Inflation Reduction Act. Every single Republican voted against it. Every single one, not one, supported it. And now Republicans Medicare to lower drug prices, all gone. Well, but you know, savings health care premiums, $800 a month for Americans on the Affordable Care Act, which Lauren worked so hard to get done, will be gone. Repeal the Care Act is the only reason why to places Social Security and Medicare on the chopping block every 5 years. That's the vote to cut. But as it is, Republican platform they put out. All federal legislation sunsets every 5 years. If the law is worth keeping, Congress can pass it or cut it, whatever, every 5 years. In other words, it goes out of existence if we don't vote to keep it. Isn't that wonderful? And then along came Ron Johnson, Senator Johnson from the state of Wisconsin. He thinks waiting every 5 years to try to eliminate Social Security is too long. He thinks Social Security and Medicare should be in the chopping block every single year, along with veterans. Now, I want to go back. I want to go back here. Look, think about it. They didn't pay for a. They want to make it permanent. They want to slash the number of look at their forms. They allow some of the largest, most profitable companies in America to go back to paying zero. Like I said, that $2 trillion tax cut, which overwhelmingly kept that promise. Not a single penny. Go ahead. the reduced, including cutting benefits for some retirees and raising retirement age for both. Real like Lauren. Are the reason I've never been more optimistic about the future of America. Just had